All right, everybody. Dr. Eric, the fitness physician, and I got another episode of the Relentless Vitality Podcast. I'm super pumped to have a very like-minded and cool, excellent, and talented physician on the show, Dr. Jack Wolfson. He is a board-certified cardiologist, and he, like myself, stresses the importance of lifestyle nutrition, supplementation. He's got an extensive background in the world of cardiology, where he was a chief fellow at his own cardiology program and has taken to a whole nother level down in Arizona. He's been chairman of medicine, director of cardiology, and director of cardiac rehabilitation. He was one of Arizona's top docs in 2011, and he's since founded his program called Natural Heart Doctor. And he does everything related to holistic heart care, virtually and in person. And he's doing an amazing job up there. So, Jack, welcome to the show, my man.
Thanks so much, Dr. Eric. Pleasure being on, and yeah, look forward to sharing this information with your tribe, my tribe, anybody who wants to listen. If you want to listen, great. If you don't want to listen, we'll see you later. But I think we got some good information for everybody for sure.
Absolutely, absolutely. So I heard Jack on another podcast, and as you know, he kind of has a similar but different background as me. I was in the world of emergency medicine and just seeing people sick and infirm, and I saw how a lot of this could be turned around with paying attention to how you eat and how you exercise and how you take care of your body as naturally just lifestyle optimization. And Jack does the same thing. So he has a great motto, which I love: eat well, live well, think well. It's just fantastic. I love that. So yeah, man. So Jack, just tell me real quick. I guess maybe, I've talked to my audience about, where I was in ER, how I got into preventive health, maybe just a quick background on how you created, the Heart Doc, and then we'll dive into the world of heart disease and cholesterol and all that good stuff.
Yeah, most certainly. I mean, listen, and certainly as an ER doc, listen, God bless the men and women who work in emergency rooms and trauma centers. Is always a place for them. But I would assume, you go into medicine to help people, and somebody comes into your emergency room and they're having a heart attack, and you're like, okay, well, listen, here's your aspirin, here's your emergency meds, and I call the cardiologist, and they're going to take you to the cath lab, and they're going to do an angiogram, angioplasty, and take care. And so often I would hear a lot of these emergency room doctors that would very, very quickly get attached to these people in the emergency room and go visit them later on in their hospital stay. But one has to obviously think about, why did this happen to that individual person, and how can one prevent that in the future? And obviously that's where I think that's where things took, where you went, and that's ultimately where I went. Like, why are these things happening to people? And my muse for that, or my inspiration, was meeting my wife. I met my wife in late 2004. So coming up on 20 years, and she, I would say, pulled me out of the medical matrix. She woke me up to reality. And the reality was that I was in the largest group in the state of Arizona. I was on my way to being a senior partner in that group. And I was prescribing a lot of pharmaceuticals, a lot of surgical procedures, angioplasty, stents, pacemakers, all this kind of stuff, making a lot of money doing it. But when she opened up my eyes with these initial conversations, it was like, am I really helping people? Am I really making a difference? Am I, and then you look at it and you're like, wait a second, people are on all these different pharmaceuticals. They feel lousy. The benefits are trivial at best. And the hospital is a revolving door, right? People come in through your emergency room, and we put in a stent, we tune them up, we send them out. But then 3 months later, they come back in, more chest pain, another heart attack, side effects of pharmaceuticals. They're in congestive heart failure. And we all went into medicine, I believe, to truly help people. And then when you look at it, you're like, okay, are we really, are we extending lives? Are we making people's lives better? Are we preventing cancer, heart disease? So ultimately, I would decide no. I would leave that big cardiology group eventually in 2012. It took me some time to step away. But again, that was 11 years ago. And super happy to be on the path that we're at. And sometimes not a popular path, but it's the right path.
Awesome. Excellent. Excellent. No, that's fantastic. Yeah. And I agree 100% with what you said. So, I definitely want to talk to you about some diagnostics, and we'll talk about lifestyle. Of course, everybody's always, of course, asking about, the animal, the elephant in the room, right? Let's talk about cholesterol and the deep dive there, because there's still so much, I feel like, so much misinformation. And as you and I both know, that statins are, I feel, way overprescribed. I see so many people on them, and they probably don't need to be on it. And they have a place, a time and a place, but we know the world of politics and economics. So we could talk about statins, but biggest thing is, like, let's talk about cholesterol and all the numbers. I mean, me personally, I always do more of a deep dive. I always get the advanced panels on my patients: ApoA, ApoB, LPA, so on and so forth. So I'd love to get your take on the whole cholesterol dogma, I guess, and we can dig in a little bit on the numbers, how to optimize them.
Yeah, definitely want to talk about that. I definitely want to circle back on statins because I've not written a prescription for statin drugs in over 10 years and I never will. So I will disagree with you, and hopefully you'll agree with me at the end of this conversation about time and a place. But I mean, that being said, I mean, you're right. Cholesterol has, that's why every animal on planet Earth has cholesterol. That's why mother's breast milk has cholesterol, why cow's milk has cholesterol, because those are the foods that the young animal needs to eat in order to thrive. Cholesterol has been vilified by the pharmaceutical companies. Yet again, every animal has it. So the cholesterol is part of every cell. It's part of every cell membrane. It makes a strong cell fence in order to let things in the cell that belong, keep things outside of the cell that don't belong. Sunshine hits the skin, turns cholesterol coursing through the skin, through the vessels in the skin, turns it into vitamin D. Cholesterol is the base molecule for all of our sex hormones, testosterone, estrogen, progesterone. Cholesterol is, of course, important in the digestion. It's made by the liver, put into the gallbladder, squeeze it on top of food, emulsify fats. It's actually so important that the body has what's called enterohepatic circulation to reabsorb cholesterol later on down the road, in the
Right.
distal intestines. So there's so many different values to that cholesterol particle. So we should celebrate that. And then the next thing, once we understand, okay, cholesterol is beneficial, then we should understand, according to 1970s data about optimal total cholesterol, which is that range of 160 to 260. That's the optimal range. Above 260, higher risk of dying. Below 160, higher risk of dying. So the sweet spot for total cholesterol, according to Framingham data, Mr. Fit trial, appears to be 160 to 260. But to your point, now let's talk about the particles, the LDL, of which they call the bad. HDL is good. Again, that's pure pharmaceutical company speak.
Mhm.
Of how we even developed the bad and the good. LDL has a purpose, again, which is why
Yep.
all mammals on planet Earth have LDL. HDL, same thing. There could be good LDLs, there could be bad LDLs, good HDLs, bad HDLs. So they try and oversimplify it in order to push their pharmaceutical agenda, which is incorrect. And then to your point, ApoB, ApoA ratio, that's much more prognostic as far as, okay, well, this is the risk of you having an event. LP little a is a very important genetic particle that people should know if they have that. Yet 90% of cardiologists are not testing for that. And here's Dr. Eric and Dr. Jack, and we're testing for that. And then again, even much more so important than the lipids are the markers of inflammation, because the lipids are reacting to inflammation, to injury, to toxins. So you have abnormal lipid production and hepatic uptake when you have a toxic burden and a toxic liver. So again, all these things are to be embraced. They're all to be optimized. And then statin drugs are not the answer. And I'm happy to expand on that.
Yeah, for sure. Before we talk about statins, real quick, what's your take on? Because and I know you do too, but I see this a lot in terms of always addressing like how do you optimize particle size? Obviously, people have a lot of small particles, or their HDL is low, which is always better to be high. Although the outcome studies have proven it's kind of questionable there. Maybe you could dig into that a little bit, but I always see high triglycerides, small particles, and low HDL, and those are the three I focus on the most. I don't worry too much about LDL, like you just mentioned, but I'd love to get your take on that.
Yeah, so we can talk about, obviously, everything starts with, as you mentioned earlier in your intro, right? The concept of eat well, live well, think well. Eat the right foods, avoid the wrong foods. Get the sunshine, the sleep, the physical activity, the movement. Get away from the environmental toxins, and the toxins really in a toxic lifestyle really leads to inflammation, oxidative stress. And when you have inflammation, oxidative stress, LDL and HDL particles come allegedly to the rescue because they're antioxidant molecules. They have a tremendous immune modulating role to those, which is why they become oxidized, because oxidized LDL takes on part of that oxidative process to help, recycle other antioxidants, whether it's glutathione, vitamin C, vitamin E, etc. So there's a lot of different facets of that. But, to your point, are there evidence-based supplements that we could utilize to naturally modify the profile? The answer is yes. And really what the goal is there, different from the statins, the way the statins work is that they inhibit the production of cholesterol and therefore LDL particles. that's not what our goal is, because nobody has an overproduction of those. What we do have is that we have damaged LDL particles and we have a decreased clearance of LDL out of circulation. So things like berberine, things like resveratrol, things like curcumin, silymarin, ginger, quercetin, those all have a role in increasing hepatic clearance of old LDL particles, and also have a role in reducing the oxidative stress on the LDL particles. So that's really one goal of some of these evidence-based supplements, because people would accuse us of saying, hey, if you're not using statins to reduce lipids because you don't think they're warranted, then why are you using natural remedies to reduce lipids if you don't think it's a problem? Well, again, I think it's a problem, but I believe it deserves a natural solution, not a pharmaceutical solution that I believe is extremely deleterious. All of our natural remedies do not contain fluoride, yet statins do. So, that's just one example of what the problem is. And our natural remedies are also, they're subtle and supportive of the body, as opposed to statin drugs, which are taking a machine gun, to a verbal battle, if you will, to kind of use that, metaphor. And then finally, when you mentioned HDL, and a lot of times HDL, increasing HDL gets a lot of condemnation, but the original HDL raising trial was on niacin. And that was the Coronary Drug Project. And Coronary Drug Project actually showed a markedly improved mortality benefit in the people who were taking niacin. Now, trials since then were either done with niacin in combination with a statin, showing no effect of the niacin, so therefore don't use niacin. But the problem is, again, that population was on a statin. So if you're talking to the person who is not on a statin, niacin is still very, very beneficial. And the other thing that recently put niacin into the coffin of the medical doctors, if you will, getting it out of their toolbox, was a study called Improve It. And Improve It used niacin in combination with a pharmaceutical designed to get rid of flushing called laropripran. So they extrapolate the data to say there's no benefit, yet niacin was combined with this drug, and the majority of people, were still on statins. So you really cannot extrapolate that to the person who's eating well, living well, thinking well, taking evidence-based supplements. I just don't think that information applies. Now, that being said, I don't use a ton of time-release niacin. I use it in people who do have elevated Lp(a), because it does help to reduce Lpa numbers. And then also people where maybe diet and lifestyle are not controlling triglycerides. And we're seeing that issue there as well. So that's where I'll use niacin. It's not that I use it all the time.
Yeah, absolutely. Yeah, I agree with like as you mentioned, with the triglycerides, and that's the other thing that comes up a lot too, trying to raise HDL or lower the small particles, like as you mentioned, like berberine, niacin, fish oils, things like that. Those are some of the things that have kind of in the toolbox, at least that I've tried. A few other things too. So yeah, I was curious to get your take on that.
Well, I mean, Eric, if I can, I want to, expand on that a little bit. Triglycerides are definitely, it's not that they're a problem. There's a sign that there's a problem. And that's often what it really means with lipids as well, is that it means there's a sign of the problem. So when you have elevated, the higher the triglycerides, the higher your risk. And certainly at a certain point, as you know, it could lead to pancreatitis. So, there definitely is a very importance of getting that number down for a whole variety of reasons. So time-release niacin can lower the number down. And omega-3 fish oil has been proven to lower it down. But I tell people, whenever people ask on social media, best ways to lower triglycerides, number one, eat more seafood.
Yeah.
Eat the seafood. And then number two, decrease the carbs, decrease the sugar, decrease the alcohol, decrease the starchy carbs. And that will invariably improve numbers down as well. There's been recent literature about omega-3 fish oil, increased risk of atrial fibrillation. I believe that could be true. So in general, I tend to stay away from the use of omega-3 fish oil and just push people to eat the fish or encapsulated supplements. And actually what we developed in our company are two products. One is called the whole fish, which is the freeze-dried sardine, wild sardine, freeze-dried. pulverized and put into a capsule. So you get the mouth to the tail, getting all the organs and everything from that fish. And we had a third party tested. There's no BPA, so there's none of these microplastics people would be concerned about. The metals burden is very low, as you would expect from a sardine. And then the other product is called Wild Salmon Roe, and that is the Pacific salmon roe encapsulated. And I would say, Eric, that there are no healthier foods than those two on the planet. We put them into a capsule. And that really, I think, brings into food as medicine. So I tell people, listen, I mean, again, eat the food all day long. But if you're not interested in eating the food, you don't get enough of the food, you don't like the food, there's problems with your ability to obtain the food, then the capsule version is good, and I believe better than fish oil.
Yeah, that's awesome. No, I love that. And I'm with you. I'm a big fan of I always tell people, just eat the food, and yeah, the supplements are there if you can't or don't want to or don't like the taste or whatever, kind of thing. So yeah, I'm a big fan of that as well. So no, thank you for that. I appreciate that. Well, awesome, man. Well, let's I want to talk to you. I do want to ask you some questions about prevention and scoring, CT, coronary scans, etc. I definitely want to talk about that because that comes up a lot in with the conversations with patients. And again, for people listening, and I've talked about this, and I know you have too, in terms of I always say, look, it's not the cholesterol, like you said, it's there for a reason. It's almost always inflammation or some kind of toxic process going on. That's why your cholesterol is off. So instead of lowering your cholesterol, let's find the source of inflammation and fix it. It's probably crap in the food or EMF or some type of vitamin deficiency or you're not sleeping or whatever. That's the hard part, takes figuring that out. So I just want to, for everybody listening out there, I know I've railed on this before, but it sounds like I know you're saying the same thing. So just so people understand where we're headed with this, it's not the cholesterol. It's a good thing.
Yeah, I mean, really, the body's not making mistakes. The body is just reacting to what we're giving it. So when we're not following eat well, live well, think well, the body's just trying to deal with that. It's almost like cancer is not a mistake. Cancer is happening for a reason. And that's what we have to look into as far as what is causing that. But, you brought up CT scans initially. And I'm very anti-CT scan. I'm very anti-radiation. I believe radiation is one of the things that killed my father at the age of 63 from a rare Parkinson's-like illness. So, whenever we do a test, we want to know how is it going to change the results. Right. So if you get a coronary CT scan, it shows coronary calcification. What are you going to do differently? Right. So if you believe that it's going to change what you do, so if you say, well, if your CT scan shows a score of 0, then we'll continue as planned. If it shows elevated coronary calcium, then we're going to recommend a statin. Well, I'm not going to recommend a statin. I'm not going to recommend an aspirin. So that's not going to change what I do. If someone has coronary calcification, is that motivational to them? I guess so, but I would rather motivate people about, hey, look in the mirror. Hey, look at your family. Hey, look at your numbers on a piece of paper from a non-invasive, non-radiation based test. Using those as motivational factors, as opposed to, if you're not motivated by those, if you're not motivated by looking in the mirror, if you're not motivated by looking at the numbers, the sheer numbers of the number one killer worldwide, or your personal numbers, I'm not sure what's going to motivate you. CT scans, and just the same, Eric, too, is that they can provide a false sense of security. Like my score is a 0, so I can keep doing what I'm doing. And I think that's a problem as well, because you could die still from heart disease, but you could die of cancer or dementia or autoimmune disorders and still have normal coronary scans. So not a fan of it. I think in general, it is really most utilized by cardiologists because it's what they would say is a loss leader, right? They don't make any money from the coronary CT scan. But then when they find abnormalities, now it leads to a stress test that's not necessary. Now it needs to other procedures, office visits, repeat scans, and none of it's useful.
You're not, if you have patients that are higher risk or have had a history, you're not doing scans or recommending heart caths like you used to do, et cetera.
No. I mean, again, we did it because it was very lucrative. A lot of that behavior that we did was very lucrative, and we could talk about that all day long. But that's just quite obvious. Again, doctors have been proven to prescribe pharmaceuticals because they received a free pen. I know you went through medical training residency, and I went through the same. And again, the pharmaceutical industry, multi-trillion-dollar industry, statin drugs, number one selling class of drugs of all time, and they're a total fraud. But Yeah, to that end, I think there's better ways to look at people as far as their risk. Let's look at these advanced lipids. Let's look at markers of inflammation. Let's look at homocysteine, LP little a,
Yep.
intracellular vitamins, minerals, glutathione, omega-3, CoQ10, and let's look for these environmental toxins. And if we can fix up those and we can improve their lipids and their inflammation and all the vitamins and minerals and glutathione and all these things we check for, that's the solution.
Yep.
Which is very
Absolutely.
exciting. It's very exciting and very empowering. And I know you feel the same way.
Absolutely. No, I appreciate that. Yeah, man. So let's dig in and attack the big boys. I definitely want to talk. Let's talk about statins and aspirin because I know that comes up all the time. I think whichever one you want to tackle first. I mean, it's amazing when one of my mentors, Dr. Ruze, is big in the world of hormones, but more by natural treatments and presented all the studies on statins. Primary prevention is the any benefit is like way less than 1%. I mean, and then you have a 30% risk of cancer and 20 something percent risk of diabetes, all these different, it just blew my mind the first time I heard that years and years ago. So yeah, feel free to unload on, give me your take on everything for our listeners.
Yeah. Yeah, no, I mean, I think you just, kind of briefly summed it up, there really is that when you look at the overall literature, I mean, we're not even talking about side effects. Let's just talk about benefits first. The alleged benefits, according to the people who are doing the trials, which everybody needs to understand, all the trials are sponsored by pharma. Pharma is tied into everything. So the results have to be skewed in some way towards pharma, but at least according to their literature, for primary prevention, so somebody who's never had a cardiac event, they provide a benefit of heart, myocardial infarction reduction of about 0.2% on an annual basis, stroke reduction less than 0.1%, and the mortality benefit of around 0.1% for primary prevention. So what that means is that 1,000 people need to take drug for 1 year every single day in order to save one life, according to their literature. Mm-hmm. So this should never be a scenario where a patient is getting criticized, pressured, admonished into taking the pharmaceutical drug statin, where a doctor would say, hey, take this drug or you're going to have a heart attack. Take this drug or you're going to die, because that would be highly, highly, highly incorrect. Doctors are very good bullies. They're very good at peer pressure. And it's really unfortunate that doctors behave that way. Secondary prevention for people who've already had a heart attack, they've already had a stroke, they've already had coronary disease, bypass surgery, stent, or whatever. The data in the favor of statins gets a little bit better, but only, again, a little bit better. As far as heart attack reduction, it's about 0.5% annually. Mortality 0.2, stroke less than 0.2. So are there benefits according to them? The answer is yes. But ultimately, Dr. Eric, what I would say is that it's not about how do we reduce someone's risk of dying from 2% to 1.84%. It's about how do we reduce their annual risk of dying to 0%. They don't do that. And Eric, you and I do. That's what's exciting about it. So if people want the standard, if people want, hey, listen, life expectancy for a male in the United States, 78 years old, I'll take that, with the last 5 years being in and out of hospitals and nursing homes. If you want that, then stay with the medical system. If you want the 100-year heart, the 100-year brain, 100-year body, that's what you and I are talking about. That's what we want to offer to people. We know they don't offer that, and I believe that we do through our common sense methodologies.
That's awesome. Love that answer. And it's so spot on. I would like, what about like patients? This is something that popped in my head when I was getting ready to talk to you, was like, two things. One, the first one would be like, so what about, so you have patients like, for example, I have a family member, someone who has like familial hypercholesterolemia, super healthy, active, everything we've been talking about, but their numbers are still through the roof. Never had an issue. But, of course, people are going to say, well, they need to be on, those are the people that need a statin. I'm like, I still doubt that, but what are your thoughts on that?
Yeah, so familial hyperlipidemia is really like a 1 in 200 to 250 person diagnosis. It's not that common. And again, that's data from Mayo Clinic, Cleveland Clinic. That's out of mainstream literature. So a lot of times people talk about this familial hyperlipidemia, and these are the people with total cholesterols around 400, for example. I've seen a lot of those people with extensive coronary artery disease. I've seen a lot of those people with zero coronary artery disease, like zero. And ultimately, I mean, that means again that we do have a choice on this. There's many other factors that go into it, and in that scenario, it's not a problem of overproduction of the lipids. It is a problem with clearance of LDL particles. And that is a problem with a genetic mutation of the LDL receptor or the apolipoprotein B protein on the surface of the LDL particle. So those are genetic SNPs in those particular areas. So can we upgrade the LDL receptors and the hepatic clearance? I think there's definitely strategies to do that, obviously inside of Eat Well, Live Well, Think Well. And then of course, through evidence-based supplements such as berberine, for example. Berberine would be great at increasing LDL receptor uptake and utilization. So those are the strategies that I would use for those people. But I think ultimately it should preserve, it should be more motivational for people to say, hey, listen, you do have familial hyperlipidemia. Your risk is higher. So you really have to buy into this lifestyle even more so than other people. And, and that means you need to pay much more attention to sunshine, because what if you take all that excess LDL and then all the excess cholesterol with it and turn it all into vitamin D? Do that particular strategy. Do things that really accentuate the ability of the liver to be healthy, including parasympathetic lifestyle, parasympathetic maneuvers, in order to allow for the cleansing and detoxification of the body. Maybe that's a role for more fiber, or you can decrease the enterohepatic circulation of cholesterol particles. So there's a lot of natural ways to do it. I just don't believe that statins are part of that process.
No, that's a great answer. I love that, and I appreciate that. And I'm with you on that as well, 100%. Yeah, I agree, and I tell people that too about the risk. And of course, you probably heard this too. Is especially people that have had an issue or have plaque or had an event. They're like, well, of course, you probably heard, again, it's like, well, it has all these anti-inflammatory benefits and all these other, not just about lowering the cholesterol. I'm like, well, there's other ways to do that naturally. I don't buy into that, but you hear that from, of course, from big pharma and from the docs, and about statins, all the other benefits besides lowering the cholesterol. And I'm kind of doubtful of that, but I think there's better ways to do it.
Well, I think you're talking about the pleiotropic effects of statins, right? And how it
Yep.
may be anti-platelet, anti-proliferative, improves endothelial function, lowers inflammation, lowers oxidative stress, and all those things. Yeah, to your point, they may be true as far as the alleged mechanism of statins, but here's the problem: we know the outcomes data. So whatever they say it does.
Yeah.
It doesn't do much. It doesn't do much, and it doesn't do anything meaningful. And I believe it also leads to a sense of complacency, where statin drugs lead to a sense of complacency, where I've said statin drugs are responsible for killing millions of people, because doctors like you and I have historically said, take a Lipitor and eat whatever you want, live however you want, doesn't matter. And unfortunately, that was just a really, really false, promise and prophecy of people. So again, by leading to that sense of false sense of security, I think it's just highly problematic. And to your point, there are many different ways to improve endothelial function and anti-platelet, anti-smooth muscle, anti-proliferative, inflammation, oxidative stress, but by going after the cause of that.
Yeah, excellent. What if you you feel, are you able to reverse plaque or slow down the process? If you have someone who comes to you and they've already had disease or had an event, how many decades ago Linus Pauling had his protocol for different amino acids and vitamins, etc., to reverse plaque. There's a lot of other things. What have you done in that situation? How do you deal with that?
Yeah, so the Linus Pauling protocol, that was based on amino acids, as you said, lysine and proline, as they improve the collagen matrix, and therefore would improve the endothelium, the intima, the media, and adventitia, basically the entire blood vessel. And what Pauling thought was that it was deficiency of these amino acids, also a deficiency of vitamin C, which is involved in the cross-linking there. And vitamin C is of course, a famous antioxidant as well. So what he thought was excess oxidative stress in the blood vessel lining that would lead to disease, what he would call a form of focal scurvy, where there was a vitamin C deficiency. And I think that ultimately that vitamin C would be a Band-Aid approach, although a better Band-Aid approach than pharmaceuticals, but still a matter of, okay, well, what's leading to that oxidative stress in the blood vessel? That's really what's critical. But nonetheless, if you test people's vitamin C levels, and you could do that on a serum and also intracellular basis, and you find that those are low. If you find the amino acids are low, then there's a time and a place to either supplement those or increase their intake from food. But ultimately, that blood vessel health is paramount. Also, what comes into play there is copper, and copper sometimes has been vilified even in natural circles. But copper is a cofactor for an enzyme called lysyl oxidase, and lysyl oxidase is involved in the cross-linking of that collagen matrix. So there's many other vitamins and minerals that are involved in that whole process. Mm-hmm. But ultimately, there's many. It just kind of goes into what is causing the disease. And what the doctors are typically doing is they're trying to Band-Aid the disease as opposed to figuring out what the cause is. And as I've said 5 times, and you've repeated it as well, right? The violations of eat well, live well, think well. But I would love to just kind of throw this out there to everyone who's listening, that one of the violations of live well is living with environmental toxins. And the famous toxins, of course, are things like mercury and lead and cadmium and radon gas. And as you mentioned, environmental toxins are electromagnetic fields, right? Where people are sleeping with their iPhone and, they got the smart meter and they're next to the power outlet, and they got a cell phone tower next to their house, and the Wi-Fi router. I mean, all these things of EMF, which I think are ultimately all extremely problematic. But I would say out of all the environmental toxins we can think of, there is one that's most dangerous. And that one thing that is most dangerous is mold. Mold, the fungus from water damage in a home, I believe, is the single biggest source of chronic disease that we see today. And the number of doctors, Eric, who understand that, certainly I'll speak to the cardiologists. I mean, again, I can't even think of one who understands that at this time. And it's interesting that when you think about mold versus these other environmental toxins, it is more sinister because lead, arsenic, cadmium, aluminum, radon, EMF, air pollution, plastics, all these things, right? I mean, millions of chemicals. Right. They do not have the deliberate intent to injure. So mercury in an amalgam or in a vaccine, or lead in a paint, does not have the deliberate awareness to injure. Mold does. Mold is a living, breathing organism that wants to survive, and it wants to get rid of things in its environment that may be competitors to the mold. So we think about, what is penicillin? Well, penicillin is a mold mycotoxin that comes from mold that is used by the mold penicillium to kill off other fungus and bacteria that inhibit. So that was discovered in the 1920s, and penicillin is used as a pharmaceutical to kill bacteria, but it is a mold mycotoxin. Another one that I'm sure you're familiar with is a pharmaceutical called Cellcept. Mm-hmm. And Cellcept is used to prevent organ transplant rejection. Now, it's not something you would have prescribed in the ER or something I would have prescribed as a hospital-based cardiologist. But we often would see people on that who received an organ transplant, or maybe they had some kind of an autoimmune condition, so they're put on Cellcept. The generic name for Cellcept is mycophenolate. It is mycophenolic acid. Myco meaning mold. Mycophenol it is a mold mycotoxin that was discovered in 1933 to be an immunosuppressant, and they put it into a capsule for people to swallow to suppress the immune system. So what does that mean when people have high levels of mycophenolic acid in their body, and we would test that in their urine? If they're excreting high levels of mycophenolic acid because they're being exposed, what is that doing to their immune system?
Yeah. Nothing good.
And nothing good. not unless they have the organ transplant where it'd be, I guess, theoretically beneficial for that person. But for the 99.99% of people who are walking around without organ transplants, what is it doing to your immune system? What does that mean in the face of the COVID diagnosis? What does it mean as your immune system modulates cancer cells, or how your immune system interacts with endothelial cells and intimal cells and macrophages and foam cells inside the vasculature? It's really fascinating, and again, I think it really represents an amazing area of study that there is some data on. I've got a 45-minute presentation on this on my website. But I guess if people are listening, if they're looking for a good take-home point, please check yourself for mold. Check your home. Check your environment. Don't believe, test, don't guess. Don't believe that you don't have it. I don't care if your house is brand. I don't care if you moved into it yesterday, because you live in Ohio. I'm from Chicago. I live life in Colorado and Arizona. Homes are built out of wood, and a home that is made out of wood will have mold until proven otherwise.
Yeah, no, that's a great point. That's something I've learned about a little bit just in the last few years about mold. I'm actually going to have another test done myself because I'm damn sure I have mold in my house. I'm sure I do because and are there companies you recommend for testing your house, and do you recommend patients, do you do any testing for patients like visual contrast, tests, or like urine samples for mold and things like that?
That's a great question, and thank you for asking that. And that really helps to establish you as knowledgeable about these things. So you talk about visual contrast, uh, testing and other modalities, and really you can check for other markers of inflammation as well that can be consistent with mold. But I think ultimately where I'm at right now is that I'm doing urine mycotoxin testing. So we're testing the urine for mycotoxins, which means if they're in your urine, it means they're getting into your body through lungs, through your breathing in, through eating it. And then the other thing is, testing the home. And my favorite test is what's called the Swiffer test, or the ERMI test, where you collect dust samples and you do it that way and you check. So there's a lot of different ways to test for mold, and I suggest doing them and doing them all if need be.
Yep.
And then again, once you do find that, or if you need help, you can get a quality inspection. My favorite company is called Yes We Inspect. I think they're the best countrywide at that, and they're really working on putting boots on the ground everywhere, because it can be problematic. And then again, once you find it, well, now it's a matter of, okay, what can you do to remedy the situation? Sometimes there's a smoking gun that can be fixed. Sometimes mold is in the fabric of the home. It's just, again, when you have a home that was constructed in Chicago and it's made out of wood, therefore the wood was subjected to the elements. And yes, some of those, wood can be treated and things like that. And even to the best of those abilities to treat the wood, it's not going to make it mold proof. It can limit it. But again, the stakes are too high. It is too damaging of what mold mycotoxins can do. And again, this is in the literature. So ultimately, some people, if they're sick enough, if they're toxic enough, if they've got enough of a brain fog, if they've got enough disease, if they've got cancer, they may have to move out of the home. Air purifiers are a secondary measure, and then detoxification strategies, whether it is our binders that people can use, sauna, other methods of improving detoxification. Those could be useful.
Yeah, that's what I was going to ask about next, because I know there's a whole host of treatment options, anywhere from something like you said, binders and colchicine and stuff, to whole detox programs, and there's a lot of things there. And I use sauna regularly. I have a red light, and we have an air filter, but I know we still have mold in the house, and I'm going to get it. I need to get it tested ASAP. But that's my goal for the next quarter, is to rip out our old carpeting and get everything tested and treated. And it's everywhere. It's everywhere.
And it is a big deal. Mold is a big deal, and it can be very very expensive. It can lead to a lot of strife, in between families. Typically it's the woman who's suffering, and the man says he feels fine. Now, this is the same man who's he's on lipid drugs, and he's had a heart attack, and he's got erectile dysfunction, and he's 30 pounds overweight, and he's got metabolic syndrome, but he feels fine. The woman doesn't, and for some reason, and I have definitely many different theories on why women are more affected than men, but nonetheless, it's something that we need to up our game on, that we need to understand. a lot more. But I think, for you and I, as we kind of look at the patients we've seen over the years who, wow, it seems like that person was eating really well. And yeah, they got sleep and they got sunshine and, they were physically active and they practiced yoga, meditation, Tai Chi, yet they still had an event. There was still some environmental toxin that affected them. And I believe mold is again at the top of that list. It really helps explain a lot of the complicated cases. If I may say one more point too, because I think this is probably something that impacts you in the great state of Ohio, which incidentally I was born because my father was the first DO at the Cleveland Clinic in
Oh yeah,
1970.
nice.
My father was the first DO at the Cleveland Clinic, first DO at University of Iowa. He was the fifth DO in the American College of Cardiology. But Lyme disease
Mm,
is not necessarily quite as classically endemic in Ohio, maybe as it is in Wisconsin, and certainly in
right,
Lyme, Connecticut, where it came from. But Lyme um, is an infection from a tick bite that leads to a parasite called Borrelia, and that could lead to acute Lyme. And I've seen acute Lyme carditis when I was in training, specifically in Chicago, or chronic Lyme, as they would say. But it never really sat well with me, this chronic Lyme diagnosis, because I believe that we came from the ticks, we came from the environment, we came from the outdoors, right? Our bodies have immune systems that are built to withstand a tick bite. So
right,
why would people get sick from a tick bite? Never really made sense. It's because they are immunosuppressed because they live in mold. So either mold is causing all of their symptoms and not Lyme at all, or mold is inhibiting the body's immune system's ability to clear the Borrelia and Bartonella and other co-infections. So that ultimately is the issue. And the issue, of course, would not be chronic antibiotics, which never again sat well with me. And of course, mainstream medicine does not believe in the chronic Lyme diagnosis, but alternative medicine does. And I believe they would use therapies, which I think may have been helpful to people, but again, not going after the cause. And the cause is because they are immunocompromised from living in mold.
yeah. No, I appreciate you saying that because it's timely too. Because actually, not too far from me, I've heard of a lot of people in my network, not a lot, but a handful who all of a sudden they've got Lyme, they've got Lyme, they've got Lyme. I'm hearing it a lot. I've heard it a lot this summer, which is that I did the same thing. You know, I kind of scratched my head. I thought that just doesn't sound right. Like, and maybe it's true, but again, why? Did you get the shot? Is your immune system down? Or do you have mold? Who knows? But yeah, the whole chronic thing again, it kind of like the whole people who have had mono or other viruses years ago and they're still suffering. I'm like, well, it's probably because there's something else going on. They have some underlying immune defect, adrenal, problem, immune system deficiency, nutrient deficiency, something. Because, like you said, our bodies are meant to handle that. So, there's something else there, I guess, is the bottom line. You got to dig a little deeper.
Well, and that's the beauty of doing what you and I do is that we take the time and the effort to dig a lot deeper on all these different things and really get to the root cause. As a conventional cardiologist in mainstream medicine, right? I mean, it's a 5-10 minute office visit, and you're just trying to identify the problem as quickly as possible and address that problem with a pharmaceutical or a procedure, all while you're trying to make extra money and see more patients. In the emergency room, right? I mean, you could have a waiting room, full of people, and your job as an ER doctor is to make sure that person is not dying. And if they are dying, get them stabilized
Yep.
until other things can be done. The job of the ER physician is not to sit there and take the history of like, okay, well, let's talk about what was going on before your heart attack. Let's
Right.
talk about your stress.
Right.
Let's talk about your lifestyle. Let's talk about all the, did you get the shot? I mean, so a very good friend of mine from my medical training, he's like, well, I'm an ER doctor. I see a lot of people, and I haven't met anybody who's had a negative reaction to the shot or any other shots, prior. And I said, have you ever asked people their history based on that? And the answer invariably is going to be no. You never ask people what happened just before the heart attack. You're just like, I'm identifying that you're having a heart attack, and my job is to give you XYZ pharmaceuticals, and we call in the cath lab, and I get you stabilized in order to transfer you to that place. And that's where kind of the job of that doctor ends. And again, that's a very important job. I'm not diminishing that, but at the same time, doctor, ER doctor, don't admonish, diminish what we're trying to do over here in order to keep them out of your emergency room.
That's a great answer. I appreciate that. I'm assuming you've had a lot of patients you've taken care of and who've had mold. And obviously this is a whole conversation in of itself, but like Cliff Notes, what have you found to be successful in terms of helping them, in terms of getting rid of the mold or treating them, you know?
Yeah, again, that whole concept, eat well, live well, think well. So if we think about, eating organs or taking organ supplements, if we think about eating seafood or seafood supplements, like those are going to be the great place to start. Of course, getting rid of things, such as alcohol, artificial things. Again, you get cleaning up the diet, the sun, the sleep, all these physical activity things, and clearing out all the toxins, thinking the right thoughts, believing that you can recover. Thinking well is just as important as eating well and living well. So that's, of course, very important. And then, these evidence-based supplements that are known to bind, known to enhance detoxification. And then you mentioned, red light, sauna, they all have a role. I mean, we know that mold mycotoxins are in sweat. It's been tested. They're in the sweat. And why wouldn't they be? I mean, again, the
Yeah.
body's excreting toxins. They will be in the sweat. So you better be sweating.
Right.
And do you have to have a sauna to do that? Can you go exercise? Can you go, again, into a very, warm environment and start to sweat? All that stuff is all going to be beneficial. But the answer is really, get it diagnosed and get it fixed.
Yeah, absolutely. Absolutely. I love that. Yeah. And I know, I know you've talked about this too. And I'm big on like always addressing the gut, the microbiome. I think it's an area that's we're still learning about, and I think so many people have gut issues. And I think I'm glad you brought that up too, to focus attention on that. Like you said, the toxins, the mold, the gut, those are all important things that sometimes get overlooked because there's no quick fix. Unfortunately, it's a process, so.
Well, and mold mycotoxins, a lot of their toxicity, and again, this is in the literature. So when I do my presentations, I show these slides about how one of the first ways that the mold mycotoxins impact the body is through the gut microbiome. So they damage the gut microbiome because, as much as we said, these are toxins. And if mycophenolic acid destroys bacteria, and that's why they used it as penicillin, and they call it, immunosuppressives or penicillin is from penicillium, and it destroys that. So if you're taking in, basically, if you're living on penicillin, which is coming from mold, not from a pharmaceutical, but what does it do to your gut microbiome? That is proven. The mold mycotoxins leading to leaky gut, or what's known as intestinal hyperpermeability. That's in the literature, multiple studies. So, and then now, once you have the destruction of your gut microbiome, intestinal hyperpermeability, all bets are off. These things get into the body, leading to immune system activation, inflammation, oxidative stress, and then ultimately to overt sickness. So mold mycotoxins are definitely tied into the gut microbiome, just as gluten may be, and plastics, and pesticides, and glyphosate, and everything else.
Yeah, awesome. Well, I'm going to start winding it down, be respectful of your time. You've been full of awesome tips and information. I love it. And definitely have the same attitude and thoughts as I do. Any other, I know you've got your total programs. I'll let you, I want you to plug those things, but any other actionable tips for our listeners? I know you can't give away the farm, but any quick, simple things you could recommend to our listeners?
No, I mean, I think that ultimately, right, eating the foods that we've talked about, whether you believe in evolution or the biblical version or a combination thereof, which is my personal belief at this particular time. And our beliefs are always changing and morphing. And I think that's the beauty of doctors like us, is that we're just open to new ideas as opposed to very closed-minded, which is true of most medical doctors. But,
Yep.
first there was the darkness, and then there was the light, which to me is all about circadian rhythms. It's all about sleeping when it's dark and being active and awake when it's light. And when you violate circadian rhythms, you're going to die sooner than later. And people could listen to us and they're like, wait a second, I can't afford to eat wild salmon raw, or swallow your capsules, or, take your course, or do, and even the mold aspect. They're like, okay, wait, I can't afford to do this or this or this, or my loved one. Okay. Sleep is free.
Mm-hmm.
Sunshine and being outdoors is free.
Yep.
Physical activity, movement is free. Meditation, gratitude, mindfulness, those are really good strategies that are totally free, affordable to anyone and everyone around the world. And the more we practice those, the better. So understand that your skin is a solar panel. Embrace the power of the sun. Smart sun. You and I, Ohio, me growing up in Chicago, we went down to South Florida for spring break and got burnt. That was bad. But sunshine is good. Embrace the power of the sun, increase vitamin D, increase nitric oxide, produce melatonin, which is another miracle molecule. So hopefully those are just some simple strategies for people to follow.
Awesome, man. Thank you. One last question I always like to ask everybody: are there any good non-medical books that you're reading right now?
Ooh, non-medical books that I'm reading right now. Well, I love books that have to do with freedom. I love books that have to do again with our freedom of choice, freedom to decide. One book that I recently finished is called The Creature from Jekyll Island. That is an amazing book, really, that
Yep.
starts with kind of like the founding of the Federal Reserve in the
Yep.
early 1900s. And I think when you read a book like that and you look at it you look at society and what's happening right now with the lens of there are people who are trying to control it all. They're
Mhm.
trying to control it because of greed and money. That would be obvious. But could you, and this is not from that book, but could one comprehend the idea that the people who pull all the strings in the world, they do it because they're bored. They
Power
have
thing.
they have everything.
Yeah.
They have all the money, they've got all the power.
Yep.
And when you have all the money and the power, they're philosophically this leads to boredom of people when I mean this has been studied that for the people who have everything that they look for something different. They look for something for a dopamine surge, and
Right.
if you can't get dopamine surges from power and from or from money, then
Control.
then you want some excitement in your life. What is the excitement? If you can afford every car, if you can afford every trip, if you can afford every luxury you can ever think of, what do you do for that dopamine hit? And this is where that comes in. You set the world on fire and you see what the results are. So I don't mean to go too crazy, but you asked, and that's my thoughts.
No, I love it, man. And you're spot on. I think you and I could talk for hours about this because I'm the same way. And I've not read that book, but I've heard G. Edward Griffin talk many times, and I'm familiar with it. And yeah, as you said, it's a greed and power, and there's a whole bunch of idiocy going on in the world. And I think you're spot on. That's a good way to look at it too. And that's another aspect to look at. I love it. So yeah, I think you and I are on the same page there. So
Awesome.
awesome, man. We'll plug your website and feel free to say whatever you want to say about your page, your social media, anything else.
Yeah, I mean, listen, if anyone who's interested in seeing me, it's come over to naturalheartdoctor.com. Myself, there's another cardiologist there, Dr. James Kneller. I've got two naturopathic doctors who work for me, and I've got a chiropractor in the office, a team of health coaches. And, listen, I can only say, Eric, hopefully, doctors like you and I are doing right in the world and we're doing good things in the world, and the rewards will come to the people who do right. I hope, again, that if people are suffering out there with cardiovascular concerns, come talk to us. At least get that second opinion.
Yeah.
You asked about, again, like our non-medical book that we're reading, and again, I think it's just knowledge is power. So get that
Absolutely.
second opinion. You can agree with me, disagree with me, but again, just long gone are the days of the 1970s where the doctor's God and it's my way or the highway. I mean, get that second opinion and then make it a good decision for yourself.
Awesome. Well said. Well, Dr. Jack Wolfson, I appreciate your time. Thank you for coming on the podcast, and maybe we'll get you back on again in the future. I appreciate it. Thank you.
Thank you.
All righty.